Welcome to Diseases with Dr. Deer. Today we're going to be talking about diabetes in dogs and cats. Diabetes mellitus occurs in both dogs and cats. It's a chronic disorder of carbohydrate metabolism and can be secondary to an absolute or relative insulin deficiency. It tends to be spontaneous and occurs in middle-aged dogs and middle-aged to older cats. Certain breeds of dogs, such as Yorkies and Schnauzers, are predisposed. However, any dog breed can be affected. Obesity is correlated with diabetes in cats. Diabetes involves the pancreas, which is an organ that secretes insulin to regulate blood sugar. Insulin is released in response to high blood sugar to bring the blood sugar down to normal. In diabetes, this insulin is not released, so blood sugar remains dangerously high. Diabetes occurs secondary to immune destruction of islet cells, like through severe pancreatitis in dogs, or via amyloidosis in cats. Dogs with hyperadrenocorticism, or Cushing's disease, or chronic administration of glucocorticoids can develop insulin resistance and secondary diabetes mellitus. Clinical signs of diabetes mellitus are generally slow and often missed in the early stages. These pets have signs of increased thirst, increased urination, increased appetite, weight loss, and weakness. Dogs will also develop cataracts, and cats can develop diabetic neuropathy. Diabetic animals are also prone to chronic or recurrent infections, such as UTIs, prostatitis, pneumonia, and skin infections. Diagnosis is confirmed via persistent high blood sugar and sugar in the urine. Normal blood sugar in dogs and cats is between 70 to 150 and can trend a little higher in stressed cats. To differentiate between high blood sugar from stress and high blood sugar from diabetes, a fructosamine can be run. Treatment of diabetes involves insulin and dietary management. In cats, there are some oral medications to help with diabetes. Talk to your veterinarian to see if your cat's a good candidate. Cats, unlike dogs, have the potential to go into diabetic remission with appropriate treatment. Treatment of diabetes in dogs involves insulin, which is typically administered twice a day with food. Intact female dogs should be spayed to help regulate insulin. Cats are also treated with insulin, as well as weight loss and diet modification. Recently, oral hypoglycemic agents have been developed. In 2022, a new class of drugs called sodium glucose transport protein 2, or SGLT2, inhibitors were introduced. They increase urinary glucose excretion by preventing the reabsorption of glucose, or sugar, in the kidneys. Blood glucose monitoring is an important part of regulating a diabetic. This is done through glucose curves, where multiple blood sugar samples are taken through the day to measure how high and low the blood sugar gets. From there, adjustments can be made to the insulin dose. This can be done in hospital or through continuous glucose monitoring systems like the Freestyle Libre. These are applied to your dog by a veterinarian and scanned at home to prevent the stress and cost associated with keeping them at the vet. Too high of a dose of insulin can lead to low blood sugar, which can manifest as ataxia or trouble walking, seizures, weakness, and lethargy. If your pet is experiencing these symptoms, seek medical care as soon as possible. There is a condition called diabetic ketoacidosis, which is essentially a diabetic crisis. This is where keto acids and glucose, or sugar, accumulate in the blood and can cause metabolic disturbances. These patients can be profoundly ill: vomiting, diarrhea, lethargy, collapse. Their liver and kidney enzymes can elevate, and they can have severe electrolyte disturbances. Often they have a concurrent issue, such as a urinary tract infection or pneumonia, and this can occur in known and unknown diabetics. Treatment for DKA is more involved than uncomplicated diabetes. These patients need hospitalization, close monitoring of their blood sugar, a CRI or a constant drip of insulin, and supportive care. These patients are hospitalized until they no longer have ketones in their blood, they're eating on their own, and their blood sugar falls closer to normal range. Prognosis is variable with diabetes. If caught early and managed well, patients can live several years after diagnosis. Cats can go into remission where they no longer need insulin. In a 2024 study, nearly 50% of newly diagnosed cats treated with long-acting insulin and a low-carb diet went into remission. In the same study, 40% of those cats did relapse. If you're concerned about any signs your pet is showing, or you have further questions after a diagnosis of diabetes, reach out to your veterinarian to discuss your pet's case.